Hi everyone, Sheana Ball here. I'm so honored to be the recipient of the 2020 Douglas Kirby Research Award. He really was a giant in the field, and it is so gratifying to think that some of my work can be seen as following off of his, because certainly it's standing on the shoulders of giants. I'm going to just share with you a few thoughts about some of the work that we've done and hopefully give you some ideas about promoting adolescent sexual and reproductive health in your own work. Okay, so I'm going to do a whirlwind 5 minutes with some samples of our work, lessons we've learned, and some thoughts about what's coming next. But first, let's get a shared definition of what's mHealth, and we call it the use of mobile or digital solutions that facilitate healthy behaviors in individuals and to support delivery of care in clinical or other community settings. And it involves all kinds of things: the use of social media, text messaging, virtual reality, sensors, and now things like machine learning and artificial intelligence. So you can find us at that website on the top of the screen there. We are mHealth Impact, and we have, a vision that people who could really utilize these tools can be reached by them, and we want to be impactful in creating and curating great digital health solutions. Some of the examples of our work: we've had the great experience in partnering with Boys and Girls Club to deliver a text message supplement to their TOP program, which is a group level intervention for youth development. And we found that people, when they got the text messages, had fewer pregnancies than folks who did not. So it's really a testament to how you can utilize even a very brief, simple intervention to impact health outcomes. Our very earliest work involved using Facebook for HIV prevention, and we were successful there in a very short term in increasing condom use, but then also in reaching youth of color in particular. CyberSenga was a partnership with a community organization in Uganda, utilizing a sexual health curriculum among secondary school students, and we found increased abstinence for those who participated in the curriculum. Guy to Guy was a national level texting message program that increased HIV testing among young gay men, using not just text messaging, but a lot of gaming things like badging and leveling up that resonated with the audience. And then finally, a couple of great examples of youth mental health as a critical issue for healthy youth. We want to focus on increasing resilience and access to care for mental health concerns among youth. This is a partnership we're doing with the Ohio Public Health Department. We also have a partnership with the Northwest Indian Area Health Board to focus on increasing access to mental health services for Native youth. Overall, some of the key lessons we've learned, especially when you're working with youth and using technology, you have to integrate youth early and often. They really are leaders. They really have a lot to offer. They have more to offer in terms of what's relevant and what resonates for them. So use them as your teachers, use them as your guides. We can do a much better job in reaching marginalized groups and groups facing disparities in health outcomes than we have so far. And I think making them a priority for our work is really important and critical. And then having an eye out for what's next. Things like chatbots and using Twitter and using artificial intelligence, as well as sensors. These are things that are coming down the pike. So my advice for you is to use all the things that are important in face-to-face programs in your mobile health solutions. Relationships are critical. Developing relationships with community organizations, with the audiences you want to serve. Getting people engaged and holding their engagement and attention is critical. And then don't forget innovation. Utilize those things that are new. I'm hoping soon to be on TikTok. Not me personally, but some of the programs that we're working on. So in conclusion, I just wanted to thank you once again. It's an honor to be the recipient of the 2020 Douglas Kirby Award. And I hope to see you online when you're doing great things and promoting health among youth.